Okay, now, are there any questions at all before we start? Yes,
Would you explain the detox, both the foot and also the detox tea? What it detoxes when you need it?
what was the first part of the question?
Would you explain about it?
Which,
The detox tea and also the detox for your foot? You know, you put the little things in your foot at night,
the patches,
the patches.
the sap patches for the feet
Mhm.
are very simple.
But what do they detox? Do they detox like?
The blood. They act like, so whenever you put the patches on the feet, the chemicals in the herbs, whatever they put in the bag, help draw out toxins that are not convenient and comfortable in the blood.
In the blood,
In the blood.
okay.
Much the same as when you put your feet in a foot bath with A-ray. That technically turns the feet into modified kidney for a while. Helps clean the blood. The patches are very convenient and they're very effective. Who's used the patches? Okay, when you use the patches, they most of the time will turn dark. That means they suck things out, and you can use them over and over and over again. It's inexpensive. You can order them online. I have a few if you want to try them.
So you said you can use them over again? Not just
No,
one time? No,
one time,
one time,
but you can continue to use them.
a new one each time.
Yeah, I recommend if you're going to do that you do one night, skip a night, do it another night. Look at the foot map and you place it on the bottom of the foot in the area of the organ that you want to treat, detox. Now, for example, the top part of the foot is the top part of the body. As you go down to the middle, you get the middle organs in the body, down to the bottom. I like to just move it down.
Are they gonna turn black every time, or the cleaner your body is, they won't turn quite as black, so you just keep using them until they lighten up, and then do it sporadically, or?
In theory, they should get lighter and lighter. But most people are toxic enough, they don't get that clean.
So don't be alarmed that they're black every time.
No, don't be alarmed if they're black every time. I have used them throughout my practice, off and on. I've had times where you get them totally clean. If they get totally light, then you don't need them for a while. But most people here, there's too much toxins. You can use them as often as you want.
You also want to make sure you're pretty well hydrated with them.
Very good point. If you're dry, they don't work as good. Thank you for that question.
What about the tea?
The tea, the detox tea is a stimulant for your body. The way I understand the mechanism of function of the detox tea that we use, it does help stimulate the bowels. It's not a laxative, but it does stimulate the bowels. I believe it also stimulates better cleansing of the lungs and the kidneys. What I usually recommend is when people are toxic, that they take a couple bags for 2 or 3 nights and then drop to 1 bag for 4 or 5 nights, then stop and then use it like the foot patch periodically. I like it a lot. I go through probably a box every 2 months.
Okay, so when you say kidney, does that affect the liver also?
Anytime
Does it clean the liver at all?
Anytime it does help the liver, but anytime you help the kidneys, you have helped the liver. But it's not a liver cleanse like the coffee enema. The coffee enema is mostly for the liver, but you do get some benefit in the bowel. And anytime you help the liver, you've automatically helped the skin, the lungs, the kidneys. Keep in mind, I don't have one of these for all of you. A lot of you had a similar handout like this. If you like this one, take one. If we run out, we'll print more of it. You can look at it. The idea that I'd like to get when you look at this picture is the fact that if you have a misalignment in your spine, anywhere it does affect organs, always. The bad news is most of the time you can't tell because it's a minor change. It would be like having different lights in here and having a rheostat on one. If we had a rheostat on one bulb, we could dim that bulb a little bit, and you'd probably never notice. But if you looked at that bulb, you would see that it's dim, and it creates what's called a functional problem. That means there's nothing wrong with the bulb. I'm going to talk about that again right now. If we need more of those, we'll get them printed. But go ahead, just look at it, pass them around, and look at them. Today our class is on motion, balance, and alignment. That's the main topic. If the body is balanced, think of a balanced scale, like a regular fancy, like what the lawyers use with justice. On one side of the scale we have motion. On the other side we have alignment. For motion and alignment to be good, we must have balance. If we lose balance, structurally, we're talking now primarily, not totally, but primarily about the spine, the whole body. When the weight of the head is directly centered over the neck and the pelvis, right between the feet, then things move normal, and all the joints are aligned. I want to talk for a minute about the joints. If we had a pile of bones and we decided to build a body, we have about 206 bones. We put them together like a puzzle. To put them together properly, we need about 600 ligaments. Keep that in mind. Ligaments hold bone to bone. So we can pile up, and now we have a full standing adult human skeleton with all the bones, all the ligaments. If we have it balanced, we can just back away and it just stays. If it leans, we have to then attach muscles to compensate. Compensation for imbalance is expensive. For us to hook the muscles to the bones, we have to have tendons. So we take a muscle, the end of the muscle is tendon, we hook it on the bone. We take the other end of the muscle that has another tendon, we hook it on another bone. That, in my hand I have 27 bones, I have almost 100 tendons. The hand is very complex, so is the foot. They're very integrated, they work together. Now, the muscles don't do anything unless they have nerves that tell them what to do. Okay? They're kind of like men. Okay? They need to be told what to do over and over and over. But a nerve can't function on its own either. It has to be guided. So the big guide is the brain. The brain kind of controls the whole system, all the nerves. Now we have to provide fuel for the muscles to move the bones. That's where we now have blood involved. The blood comes from the heart, big arteries, goes down to arterioles, they can become smaller and smaller. Finally, way down on the right next to each muscle fiber is a capillary. We've talked about this in the past. The capillaries are very, very small, so small that the red blood cells go through them single file. Very fast, these single file. They feed the muscle tissue. The muscle tissue then functions and throws out the waste product. The lymphatic system picks it up and takes it up to the lymph nodes. That's another discussion, but back to the heart. And the lymph system goes back to the bloodstream. The blood from the capillary goes back to the heart not by heart pressure, but by smooth muscle motion, moving the blood along. That's all controlled by the nervous system. I've told you all that to tell you why it's important to have balance. If you have spinal balance and you have good motion, you have good alignment, you last a long, long, long time. But if you have imbalance in the spine, then it affects the nerve flow. Now, a lot of people think that they have a pinched nerve, so things work less. A nerve can be modified. Let's go back to the rheostat, the control of the nerve power. The power in the nerve can be turned up or down. So let's start it in the middle. You can have one of these three things happen to the nerve. You can have a pinching usually shuts down the flow. So now things work slow. It could be your gut. And as you look at that picture I passed around, you don't just...
The
When-
picture didn't come around.
It's coming all around.
I'm sorry, I didn't pass it around, and if you want, I'll get more after you, so you can have your own. But I want you to look at that and see that every organ has not one nerve. So it's not one nerve going to the heart, one nerve going to the kidney. When God designed the body, He designed it so that we would have multiple nerves go to each organ as a safety mechanism, safety feature. So you can have a nerve going to the kidney, you can have one nerve pinched going to one kidney, and you'll never feel it. You won't be able to tell it from a blood test or a urine test. Why? Because you have two kidneys and they'll get multiple nerve flow. Now, if you have a nerve that's stretched or twisted, now we're back to the control mechanism, that may turn it up. So now you might be having too much activity in an organ or a muscle. See, people wake up with muscle spasms. They call them cramps. I have cramps in the night. Why? Because they have a nerve in the back many times, and they think it's magnesium deficiency or calcium deficiency, and many times it's not. It's a nerve that's been stressed from poor posture. So it could go either way. the thing I'm trying to encourage this balance is very, very important to sitting, standing, and lying down. This is normal alignment. I'm going to pass this around. I'd like you to look at it closely. If we take the standing picture looking from the front, if you tip that on sideways, that's how you should sleep. I saw 2 people this week who complained of neck pain and headache. It was all due to the pillow. The pillow is too low. If the pillow is too low, the head hangs down. When the head hangs down, on the downside, those nerves that go back up into the head and down into the heart and down into the arms get pinched, so they shut down. The nerves on the upper side that are stressed get stretched, so they can turn up. Lots of times people wake up with numbness, tingling, and pain, neck, shoulder, headache. That should be the goal when you lay on your side. Most people sleep on the side. You should never sleep on your stomach. If you have a habit of sleeping on your stomach, talk to me and I'll tell you how to fix that. But for now, you sleep on your side. If you're on your back, you should not have a pillow under your neck. You should not have a pillow under your neck. Why? But stretch on the spinal cord.
So do you need a pillow for your ankles?
When you're on your back?
If you're looking at the picture, the ankles are going like the head. Do you need a pillow there?
If your feet weigh 12 pounds, yes.
Sometimes they do.
Pardon?
I say sometimes they feel like they do.
If you put a pillow anywhere on your lower extremity, I recommend that you put a small pillow behind the knee, just to relax the knee. You don't need one behind the ankle. If you put a pillow behind the ankle, you're going to hyperextend the knee. You're going to bend the knee the wrong way. The knee doesn't like to be bent backwards. The knee likes to be slightly relaxed.
Is it a mistake to sleep with your knees bent? And
Depends on how far you bend them. I recommend you always bend the knee slightly. If you bend your knee if you bend your knee as far as the bent when you sit in a chair, that's too far. When you bend the knee, you should bend the knee only about 10 or 15 degrees.
That's on your back, right?
Either way.
Right.
Either way,
Either way.
you shouldn't bend your knees on your side.
Just a little.
Just
About that far. If you bend them here, you stress the spinal cord. That hurts you. Don't do that. So you bend the knee slightly, you bend slightly here at the pelvis. Okay, on your side.
so it's not good to sleep in the fetal position.
Never. Never. I don't think you can ever be healthy
Yeah.
as an adult. I don't think you would ever be optimally healthy in the fetal position. In fact, I've had many people. I'll tell you about one. I let a lady come to me about more than a year ago. She had had headaches for almost 20 years. They had spent thousands of dollars getting checked medically. She'd been on a lot of drugs. And when she came to me, told me about her headache, constant headaches every day at a high level, above a 6 or 7 most of the time. Most of the time a 7 or 8. So when I was checking her, when she turned her head, her legs moved a lot. So she's laying down on the table. I said, turn your head. She turned her head one way, moved a little, turned her head the other way, moved a lot. So I knew that she had a problem because she was twisted and stuck in a twisted position, stretching the brain and the spinal cord. So I asked the question, do you sleep on your stomach? She said, yes. Which way do you turn your head? Like that. Is it comfortable? Yes. I said, okay, I'm going to stop right there. So for the next month, we said, no stomach sleeping. I taught her how to sleep. The major change she made was she got on her side, knees slightly bent, pillow between the knees, head proper. And guess what happened to her headache? Gone. They never come back. She would have never fixed that without changing that pattern. Okay, that's one example. That's a big one. Any other questions about what it said so far? Okay, so back to balance, alignment, and motion. Think of the same scale. On this time, we're going to talk about different intensities of malfunction. If you have a mild malfunction in a muscle, joint, organ, nerve, blood flow, it's mild, then you have what we call a functional problem. It's just not working, like the light bulb that is dimmed. There's nothing wrong with the bulb. There's nothing wrong with the organ. But in the body, if we leave the nerves compromised so that they don't function like they should, then you don't get the proper blood flow, lymph flow to the tissue. And the tissue then deteriorates. And when it deteriorates, it starts to break down. When it breaks down, now it's over on this side. Now it's called pathology. But that's where you go to the doctor does a test and says, you have a major problem, and there are different kinds of doctors. I'm talking about real doctors, not people like me, real doctors. Some of them have pills, some of them have knives. Okay? I work over on this side. I have innate intelligence. Innate intelligence is the power of God that's given to all of you as a gift of birth. That's what heals the body. The power that made you, the power that designed you, is the power that heals you. That's what I work with. I work over here on the functional side. Now, what if I have a person who comes to me that's over here on the pathology side? Can I help them too? Yes, and you can too. You can help your friends. All of your friends and family can do anything that I teach you how to do. Because that helps function. When you help function, you reduce pathology. Okay? You help the body heal tissue that's gone bad. Now, yesterday I had a lady sitting right there and said, my brother has pancreatic cancer. Can you help him? My answer was, I can assist him and teach him. When you have pancreatic cancer, you're told you're going to die soon. I've treated people with pancreatic cancer, and they've healed. And they've healed because they take a simple, natural approach. We're going to talk about that from the book in a few minutes. I use the old farmer approach, the bucket approach. We look for big holes in the bucket. We look for how full the bucket is. And we fill up the bucket, plug the big holes, the body heals itself. Because the power to heal the body is in the body. Does it make sense? Now, most people kind of believe that. Kind of. Not totally. Kind of. Well, why do you say that? Because they don't trust it. They go off and get a pill or a cut. They're not patient. They want to fix now. If you let innate heal it, it's going to take time because of design. Now, a quick reminder: your bodies came like a new computer. You go to the store, you buy a new computer. It has built-in many programs. That's part of the deal. You don't have to understand them, you don't have to know how to work them. Maybe you didn't even want them, but they came with the package. That's called innate intelligence, all the programs. Your body has the ability to heal. I had a lady this morning that's all worried about COVID, and her husband's worried about COVID. So I reminded her that the body doesn't know one virus name. It doesn't know the names of the virus. It doesn't care. It treats them all the same. It's just another virus. COVID, Delta virus, variant, whatever it is. There are millions of viruses that live on this earth. Your body just wants to know, are they attacking you? If they attack you, you have built in the hard drive, came with the computer, came with your body. Stem cells that are made every day, those are warriors. They're going to go where they need to go. You all know about white blood cells. If a stem cell becomes a white blood cell, then they go where they need it. Like I said before, like some of them become like the Army, Navy, Air Force, Marine, Coast Guard. They all have different things they need to do. When you have a blood test done, if you look at your blood test, it will show you the white blood count. Then it shows the differentiated white types of white blood cells. That's like, they're always there, okay? They're always there. And if they're within normal limits, that means they're ready. If a virus attacks you, regardless of the name, they go to work. If the blood test shows that they're high, that means they're working. They're doing their job. And so what do we do? Whether they call it where the rubber meets the road. What do we do to help our body fight and deal with whatever it is dealing with? Number one, we try to maintain body balance. Because when your body is balanced, you have the most available energy. Now, if we had a discussion about, okay, doc, which is more important? Food or body balance? Without question, body balance is more important to you than the food you eat.
Now on the balance part, and you're like, that's where we're gonna start to kind of get our bodies back in homeostasis or whatever. So,
Neutral posture.
thank you. So I've done this for a few days, and I just call it in my head that I'm just stirring the pot because I'm not used to it. So like we talked about this last week, whatever we do this in the morning and in the night, it just here in the manipulation, the head manipulation.
We do the sacral slide to maintain motion and alignment at the foundation. We do suboccipital release to create motion and alignment in the head.
So I've been doing that in the night, and then I end up getting a headache later. So I just feel like I'm gonna keep doing it for a couple weeks because eventually I'm stirring the pot because I'm obviously hitting some tenderness, trying to get it unstuck, doing that. And it's the same with like the muscles in the body. I've started doing a little yoga or stretching to try to get mobility back.
Whoa.
Yeah, no, I know, like stuff like this. That's what I call stretching. And
On the T-zone or what?
yeah, I do some of it on the T-zone, some of it I don't. Some of it I just try to like relax. I try to stretch out my back, but I feel in the last few days my muscles down my spine, they're kind of like tender and sore. But I keep
Good.
telling myself that I gotta not push through, but I've gotta just stir this pot. Maybe the toxins are coming out, and I'm gonna keep doing it because it will not be as sore. I won't get the headache if I, do it for a couple weeks, right? So then I'm slowly being like braces. You said braces last week. The sacral slide.
Light braces.
Yeah, like braces. I'm getting slowly back into alignment. But right now it's discomfort, like braces when you start, right?
Right.
And so I'm still on the right track
Yeah.
to get back to balance. And that's how we're gonna see the functional work versus a quick pill, a quick,
Yeah, exactly.
but it takes time. And so just because there's discomfort, we shouldn't stop.
Let me talk about part of what you said. Number one, you don't need to have mouth pain to move the teeth if you move it slow. You don't need to have spine pain or leg pain or hip pain if you move it slow. If you have pain, you may be doing the right thing, but too much of it at one time. If the pain level is 5 or less on a scale of 0 to 10, you're safe. You're within tissue tolerance. If the pain level is above 5, then you've exceeded tissue tolerance, and you're probably doing some damage.
So what if the sacral slide hurts to do?
Then you've gone too far. You've moved too far or too fast. If you have pain, if you do a sacral slide on any of the positions and you have pain, well, let's say you have no pain. You slide, pain 1, pain 2, pain 3, pain 4, I'm done. I'm not gonna go 5, 6, 7. I'm gonna stop at 4. Why? We want to maintain tissue tolerance range.
So if you're getting like cramps, like up in your back when you're doing it?
You're trying to make too much change too quickly.
Oh, okay.
Okay, now that brings up another point. You talk about stirring the soup. Keep this in mind. This is very hard for you people to understand and accept, but it's true. You're not going to fix the old tissue. Period. Old broken down tissue that's over here eventually dies. 1 or 2 cells at a time. And guess what? They're replaced with new cells. 1 or 2 cells at a time. Actually, they do by hundreds and thousands, but they just for the number, they do it slow. So you're not trying to bend the old bone back. You're trying to create all the muscle. You have scar tissue. You have fibrous breakdown. You have arthritis. You have myofasciitis, tendonitis, bursitis. It doesn't matter what you call it. The body doesn't care what you call it. The body just does the same thing. It tries to clean out all broken down stuff and put new stuff in. The new cells come from the stem cells. If you take the magnet stem, you're going to do it faster and better. But you're getting new tissue and you're training it. Okay, keep that in mind. You're training new tissue. Now, training new tissue is kind of like changing a husband or teaching one of your grandkids. You better do it slow, or they'll fight you. I think.
Husband was the wrong thing, because that's how it was.
Pardon?
It was the wrong thing to correlate, because aren't they hopeless? They don't change.
They all change. Now, trust me here. There is a continual turnover of all connective tissue. It always adapts. That's a universal law. It's not a theory, it's not an idea, it's a law. Okay? You read the book. The book says there are laws irrevocably decreed before we ever showed up here. And if you obey it, you get the blessing. If you disobey it, you get the negative result. That's the way it is. But you have to obey it over and over and over and over again to prove to the tissue that you want new tissue and you want to work right. Does that make sense? If you have pain, you're pushing too hard. Healing naturally takes longer. It's all you can always change. Even old stubborn women. Even old stubborn men. I said the wrong word.
Is that a Freudian slip?
I can testify to you that I've been married 53 years. My wife is a much better person now than she was when I married her 53 years ago. Every year she gets better and better and better, all the way around. That includes stubbornness. But stubborn is good if you're on the right track.
Well, you gotta go a little bit to the edge of the road, because I feel like the apathy and you do less and less the older you get, then you are less and less capable. So
Oh no.
now that you gotta go back to, like, you don't go up and down your stairs every day, then pretty soon, the older you get, then you can't do stairs.
Okay, let's talk about that. That's not true.
I'm getting to the point that I don't wanna do stairs.
I do more. 10 times a day rather.
But it hurts you, it's starting to hurt my knees, so yeah, let's go.
So that if doing stairs hurts your knees, you have a biomechanical problem. That's the thing we're talking about today. There is a misalignment somewhere. There's not balance. There's not even motion. It could be in the ankle, could be in the knee, could be in the hip, could be in the neck. Now I'll pass that around.
So people stop doing stairs, and then here pretty soon you can't do them at all.
That's
So
right.
you gotta push to a point.
No, you don't push. You facilitate. You facilitate. You nurture. You cannot force recovery. Okay, you'll never be able to force recovery.